Hi, I'm Beth DeSantis, the CEO of Fact Forward, and I'm interviewing partners from local coordinating agencies, or as we call them, LCAs, on our expanding the reach of effective teen pregnancy prevention programs in high need South Carolina communities. We refer to this grant as our 1B grant, so you may hear us say that throughout the interview. This project was funded by the Office of Population Affairs and ended recently. In an effort to learn more about the LCA experience, we're sitting down and doing interviews with each of the 3 LCAs on the 1B project. Before we get started with the questions, let's just talk about what an LCA is. How would you describe your role as an LCA throughout this specific project?
Well, I would describe our role as a community organization that has been in the community for a while. They know what the community likes, dislike. The community has worked with the agency on numerous of other projects, not just this project, but just other projects. And I guess in a nutshell, an agency that the community trusts. And that plays a very important part because people like to do business with people that they can trust, or they know that they can get the job done, or if there's an issue, they know that they would help them to resolve the issue.
So really the LCAs are generally the recognized leaders within their communities that already have existing relationships
Correct.
with the key stakeholders and a willingness to build new relationships with potential teen pregnancy prevention partners like clinics, schools, church
True.
groups, other youth serving organizations. How do you as an LCA impact the world of adolescent reproductive health?
Well, as an LCA, part of our role is to impact the community by educating the community. We go, into the schools and they teach curriculum about life skills and delaying the onset of sexual activity. Um, educate the kids on STIs, prevention, resources in the community where they can access those things. So it really, as an LCA, we really are the tie that binds. And as we know, if you delay the onset of sexual activity and reduce teen pregnancies, there's going to be an increase in being able to obtain education, and it ends up being a domino effect. So in the end, there's a reduction in poverty there. Our community as a whole is healthier. So as an LCA, we kind of start that domino effect and are involved in almost every step of it in one way or another.
As an LCA, I think the idea or our impact was really about. I have, I wish I could show it to you. I have this picture of Snoop Dogg and Martha Stewart all cuddled up. Their television show, they and under that I write, look for unlikely partners. And I think that is really a like a hallmark of how I think that that we impacted that it through our LCA role, is really looking at who are the people that could be in the room that aren't in the room, people that we don't normally call and issue invitations to, that kind of thing. And so I think like the impact was really helping people see non-traditional partners, how they fit in teen pregnancy prevention. So a good example might be barbers and hairstylists, and creating condom access points with those entities, and really kind of indigenous community leaders, people that we knew had great influence and contact with youth in our community, making sure that they had information and condoms to distribute when they were having. And some of these people weren't working for agencies. Some of them were volunteering with other agencies, but just making sure that they had what they needed. And so I think the value was really in helping people, I think continues to be in helping people realize how they contribute to teen pregnancy prevention in our community.
How has working with Fact Forward as an LCA been helpful in meeting your missions, your organization's mission?
There is definitely the access to funding, but also the inclusion in the measurement, the evaluation processes that we don't necessarily have the resources to get to. So, like the stuff that you all are doing, your partnership with USC and putting together statistical programs and really helping us see numbers and see how that works, putting together databases for us to really understand how that impact is really valuable for us, because we don't have the resources to work with the School of Social Work or Public Health on developing that kind of stuff.
How do you feel the LCA model is an innovative approach to community mobilization?
We believe that it's an innovative approach to community mobilization because, like we've already talked about, the LCA is identified as a leader in the community and automatically has a reputation to other organizations. So through this project, we were giving our partners all the resources that they needed so they could be successful when this grant ended. So we worked on this project with the end in mind, not in a negative way, but in a way to empower these organizations so that when the grant was over, they could continue this work. So we're excited to say that now all 5 of our school districts are still running this program on their own. And that is all because of the partnership with Fact Forward and the sustainability plan that we created so that this project could continue on when it was finished.
One of the great activities that happened at the beginning was just brainstorming about who could be there. And, with even, I mean, small agencies, but I'll say this as a person who is a minority, and is from a minority community, like it is important that we think about everybody. I mean, I'm super sensitive to that fact, is kind of what I'm saying. And the fact that, faith groups that aren't largely represented were mentioned in that room, that ethnicities that aren't often were mentioned in that room. And so people from all walks of life were a part. Um, and so I think that that was just a huge benefit for us, is the idea that anybody could have been there. And I think that process, so the start of the process was really uplifting and exciting because we had so many different types of people in the room.
That's great. Really mobilizing the entire community,
Mhm.
not leaving anyone behind.